Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Dr. Afsaneh Barzi this morning. She's joining us here from City of Hope to talk about advancements in treating colorectal cancer. Welcome to Health Professional Radio, Dr. Barzi.
Good morning, and thank you for inviting me for this interesting topic. I would be delighted to take the audience through the changes in the colorectal cancer in the recent decades and how treatments have impacted patients and consideration of some newer models of care, which City of Hope in collaboration with AccessHope is exploring.
Well, give us a bit of your professional background. What is your role at City of Hope?
So I'm an associate professor of GI oncology. GI stands for gastrointestinal oncology at City of Hope. And I, like any other oncologist, I go to clinic, I see patients, I treat patients, I participate in our tumor boards for multidisciplinary care. I'm also a medical director with a subsidiary of City of Hope that's called AccessHope, which is a very innovative way of care delivery.
Well, first off, what significant trends have you seen in CRC treatment in the last 20 or so years?
That is a very good question. I think the way I see it is we have identified mechanism to personalize treatment to our patients. Now, what does that mean? Although CRC had not seen as many new entries in terms of new drug approvals or new agents compared to some other cancers, such as lymphoma, lung cancer, or breast cancer, CRC had seen a significant growth in understanding how to basically increase the tempo of treatment or decrease the tempo of treatment, depending on the specific of the disease.
Accelerating or decelerating that treatment, depending on the level of disease. In the past, had it always been one size fits all?
It has been. It has been one size fits all. It's become more on how we choose the right patient to basically give them treatment breaks, treatment holidays, how to reduce the number or intensity of treatments that we give to some patients, maybe at some points in their course, but also how to increase some things. We have come to look at more complex treatments, more agents included in the chemotherapy for patients with metastatic disease, or more modalities are brought into the treatment, such as surgery, such as better use of radiation and things like that for both colon cancer and rectal cancer.
What type of feedback have you been receiving from both the medical community and the patients as far as outcomes based on this more personalized CRC treatment?
So I think from patient perspective, we have seen an increase or a rise in the CRC survivors. What that means is that patients who have been diagnosed with CRC are increasing in number, which is an attestation to the fact that the treatments are getting better. So these individuals who are affected by CRC are having longer life. In terms of the professional community, there are some challenges in the professional community. Obviously, we do have the community who takes care of cancer patients, which we kind of constantly optimizing the treatment, how patients are treated or what they're treated with. But there's also a broader community, and that's the beauty of CRC, that it's not just in the hands of the group that takes care of the patients. And the broader community, there remain gaps. We all know that the incidence of CRC in young adults is on the rise. Many of these patients are seen in emergency room time after time without really being diagnosed. Their symptoms, which is non-specific, it's just abdominal pain or some rectal bleeding or things like that, are explained by non-cancer issues. It may be a reflux, so let me give you a prescription, or it's hemorrhoids. It will be okay. And so delays in diagnosis in the hands of experts who are not, in the front line of dealing with colorectal cancer remains a significant issue. I am hopeful that in the near future, with increase dissemination of the knowledge about this rise in this young patient population, we can change the trend for delays in diagnosis and make the diagnosis more timely for these patients. On the other hand, when you look at the people who are taking care of this disease, you can look at those who are focused on CRC, like myself. All I do is I take care of GI cancers, primarily colorectal cancer, and thus have a higher focus or awareness of the issues related to the patients or development in the field, as opposed to the oncologists who take care of a broader patient population. Obviously, their knowledge pool or knowledge base about all cancers is much, much bigger than mine, but maybe the depth of knowledge about colorectal can get some help to optimize treatment, and that's where AccessHope comes in to fill that niche and help them elevate the outcomes of the cancer to the cancers of colon and rectal to the best it can be.
So what types of challenges has AccessHope been able to overcome?
So like I said, the treatment of colorectal cancer is evolving, and it's a multimodality treatment. Colorectal cancer is not something that's treated just by the oncologist. You do need surgeons, sometimes different kinds of surgeon. You need a colon and rectal surgeon, at times a hepatobiliary surgeon addressing the liver metastatic disease. Sometimes you need a lung surgeon to address the disease in the lungs. You do need to work closely with radiation oncology colleagues. We do need close collaboration with our gastroenterologists for both diagnosis and surveillance. So as you can see, it's a very broad group of individuals involved with the care of this patient population. And what we do at AccessHope, we kind of try to optimize. We kind of try to remind the oncologist when and how to use other experts for better care of the patients that are under their direct care. And I think that's the beauty of it. It is good to innovate and have new treatments, but it's even better to make sure the new and the right treatment makes it to the patient at the right time by their provider.
Well, doctor, if you would, give us some web resources where we can learn more.
Sure. Obviously, you can look at the cityofhope.org website that provides information about the providers, what we do for colorectal cancer and clinical trials. I also encourage everybody to take a look at myaccesshope.org, which is a website that explains about the AccessHope, its mission, what we do, and how we achieve the goals we are after achieving.
Well, I appreciate you lending us some of your time, Doctor. It's been a pleasure speaking with you. I'm hoping that we'll speak again in the future. Thank you so much.
Thank you so much. Thank you for the time.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Afsaneh Barzi. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.